All right, everyone. Good evening and welcome to this session of the Lion's Den, where we will be talking about sports medicine and neurology, specifically Black men's brain health. Once again, my name is Dr. Ashanti Carter, and I serve as the Director of Community College Partnerships at the illustrious Charles R. Drew University of Medicine and Science. I'm joined today by our two esteemed panelists, Dr. Lisa Barkley and Dr. Robert Turner. So I'm going to let them go ahead and introduce themselves. I'm going to start with you, ladies first. Dr. Barkley, tell the people who you are.
Hi, everyone. It's such a pleasure to be here. I am Lisa Barkley. I don't know how you want us to go with this introduction, but I grew up in New Jersey and I went to college at Georgetown University, majored in biology. Then I went on to medical school at Temple University in Philadelphia, which is close to home. Then I did a residency in family medicine at Montgomery Hospital in Norristown, Pennsylvania, which is a suburb of Philadelphia. And it was a community-based program, and I learned so many things about especially family medicine. But then I realized that I really didn't want to practice family medicine full time. And I did something unusual at the time. I did fellowship training in adolescent medicine and started a sports medicine residency fellowship in primary care sports medicine at Christiana Care Health Systems in Delaware. And so I've done a lot of different things since then. I did faculty member there for a long time. Was the dean of the College of Health and Public Policy at Delaware State University, another HBCU. And I was a diversity dean at University of Central Florida. And then I came here to Drew about 7 years ago now to start the family medicine residency program again. And now I'm chair of the family medicine department and the associate dean for diversity and inclusion in our new medical school.
Thank you so much, Dr. Barkley. Yes, that is how I wanted you to introduce yourself. Let the people know who you are. So, yes, now turning it over to Dr. Robert Turner. Come on and tell everybody who you are, Dr. Turner.
All right. Well, hopefully everybody can hear me. I've been having a little feedback in my headphones, but I hope this is fine.
You sound great.
All right. Well, similar to Dr. Barkley, I'm a Jersey guy as well. She's a Jersey gal. I'm a Jersey guy. But sounds like she's from South and I'm from up north. She's outside of Philly and I'm up outside of New York City. So I was born in North New Jersey and then went to high school in Central Jersey, Piscataway. Right. And so my family is from the South. They migrated up from Great Migration. My grandparents came up from North Carolina. So, and I was raised by a big old, family out there. And what was interesting for me is when I did my postdoc at UNC Chapel Hill, and I really hadn't spent any time in North Carolina prior to that. But the moment I got off the plane, walked around campus and heard everybody talk, I said, man, this is familiar because that was my people's, right? Speaking exactly like that. So my background is really involves sports. I played football, all sports in junior high school and high school, football, basketball, baseball, track. And by the time I got to, probably my senior year, it settled. Football kind of chose me. I loved it. And it was really my sport. And I was able to get a scholarship from there to go to James Madison University. And anybody who's watching football, we've made a lot of noise this year in college football because we made the transition and they, just been doing all the things. So I'm really proud to see them. And after I played in college, I wound up being drafted in the old USFL and in the NFL. Chose to play for the New Jersey Generals, played there for a year, and then I played up in the Canadian Football League for a couple of years. And then after that, I finished my career, my tell people, in baseball, they talk about you have a cup of coffee in the end of Major League Baseball, and I had a sip of tea in the NFL, but I was able to play there. Played on the good teams with Joe Montana and Steve Young, and I backed up Ronnie Lott, and people may remember obviously Jerry Rice, but I did that, and then years later, it took me probably after I finished playing professional football, I started graduate school for a PhD in medical sociology at 40. So I was way later than most everybody else. But through that experience, I was taking a class with a professor that said, write about what you know, right? And at the time, I was actually a sports marketing director. I was director of sports marketing company, and it reminded me of, just a whole lot of other things. Really, kind of the struggles I had in my transition to life after football. And so I wrote a book called NFL Means Not for Long: Life and the Career of NFL Athletes. And then from there, I got into studying brain health and aging. And so now I'm a gerontologist and cognitive neuroscientist as well.
That's what I'm talking about. Now, that is the true definition of a scholar athlete. So for all of you young people who are watching, yes, listen, this conversation is for you. So let's get into it. Thank you for your powerful introductions. So what drew you to your field of study? We talked about college and what colleges you went to, but Dr. Barkley, what drew you to medicine, especially sports medicine?
Yeah, that's interesting. I always was a good student. I knew I wanted to be a doctor since I was like 12, you know. I knew I was a good student and I wanted to help people. And my mom was a nurse, and I was, okay, I'll be a nurse. She said, well, why not be a doctor? Like, what else could you be? And so when I started hearing that, then I started to research it. This was before the internet, y'all. So this was, trying to figure it out and trying to get into programs because I didn't know any doctors. So it just stuck with me. And that was something that I set as my goal. And I kind of kept that as my goal throughout high school, and, did well in high school. And then at college, even though it was hard being pre-med at Georgetown. And I had a few professors say, you should stop. You're not going to make it. But I persisted and hung in there. And then when I got into medical school, I was like, gosh, it's so amazing. Like you get to do the stuff that you love, and you get to learn and just study the body. And so it was just amazing. I loved medical school. It's one of the hardest things that you'll do, but it was really rewarding. And then I did family medicine because I wanted to be the kind of doctor that you can drop me anywhere and I would know what to do. I liked everything and I had a really hard time deciding, but I think that was my thing. I didn't want to just only be able to do something if I had an operating room or I really liked ICU medicine. It was like I needed to be able to do something where I can take care of everybody. So I did family medicine, which I really love, taking care of the different people at different ages. But like I told you in my introduction, it just wasn't the thing I wanted to do for the rest of my career. I realized that by the third year. And like I said, at that time, family doctors don't usually specialize. And there wasn't a lot of pathways to that. But I'd always liked teenagers. And I ended up just doing a rotation in adolescent medicine. And then that was it. I just love that. Taking care of teenagers and young people is so exciting. You have to use all your skills. You don't just write the prescription. You got to really work with people, meet them where they are. It's the way we should practice medicine, I think, overall. So I love that. And I also I wasn't a real athlete like Dr. Turner. I was gymnastics, dance, and stuff like that. But I always was really fascinated by sports. I always loved sports. My brother was a really good football player, and I love sports, but I was always fascinated about how do you get people well? How do you work with people who really are motivated to get back to doing a sport and doing that at a high level? So I asked the folks at the fellowship program was going, it's like, I really want to do sports medicine too. And they said, we can do that. We can start it. So I was the first person to start this sports medicine fellowship before it was even something the family doctors did. And I did that for 2 years, and there's just no looking back. I just love it. I love, the excitement of, really being able to be prepared to take care of a team and to handle the things that happen, the follow up afterwards. And since I'm a family doc, I like that relationship. So I like being able to follow the kids over time and see how they're doing. And I just feel like as a Black woman physician, it's really important to be in those spaces where a lot of our young people are. So many of our males are playing sports. And I found that sports was a really great way to get to teenagers and then try to help them overall. So I just have probably a different take, but that's how I got there.
Wow, I love that. Thank you, Dr. Barkley. So relationship building, but you said that it started with that spark of just wanting to go into medicine. You thought it would be one thing, but it turned out to be another. So that's amazing. So Dr. Turner, I mean, you talked about playing football and all of that, but that transition, talk to us about that, sir.
Sure. So I'm probably again a little bit different than Dr. Barkley because for me, in a way, maybe I was a lot alike because all I knew when I was a kid, maybe as early as 7 or 8, I knew that I wanted to play professional football, right? That was all I wanted to do. I mean, that was it. I knew from a very early when I saw the guys in my family screaming at the television, I actually didn't even know what they were all excited about. I just remember, like it was vivid, like yesterday in my own mind's eye. But I was playing on the ground with trucks, toys. I was a snotty little kid. They probably were tripping over me, but they were screaming at the television at their height of their lungs. And I just stopped and I looked and I said, I don't know what that is, but whatever they're doing, that's what I want to do. I said, because it can make people that excited, I want to do that. And so that was my journey. That was my path. That was everything for me. I'm a little ashamed to say, but like for instance, had it not been for a football scholarship, I probably wouldn't have went to college. I would have followed like a lot of the men in my family that were in the military. My dad was a staff sergeant in the Marines. My grandfather was in World War II. Every male on my father's side, they had all been in the service, right? We didn't have the money to go to college, so that was where I was going to go. And the matter of fact, and to be very honest with the people out there, is that I only went to college because I knew that was the pathway to get to the NFL, right? It wasn't as though I had a burning desire to go to college. In fact, I really didn't know anything. I was first generation in college, and where we were, my school, we moved out of the inner city to a suburb. Parents give me a better education, and they were not trying to help Black folks try to really understand, especially boys, men, trying to understand what it takes to go to college. So I was playing basketball one year, and the statistician on the team, she came over and she was talking to the guys, and she said, "Well, what is your GPA?" And I was junior in college at the time, and I was like, I have one of those? Like, what is that? I never heard of that term before. No one ever talked to me about that. She was like, yeah, and you also have a cumulative grade point average. I had no idea, right? So that was like crazy to me. But anyway, I wound up going to college because again, they like tracked a whole bunch of the Black men in particular, do technical skill stuff like that. But in my school at the time, we had a technical track, a college prep track, and then of course they had the AP track. And I can remember very vividly, it was myself and two other Black men that we all played sports, that we chose to go the college route and college prep. And the only reason I chose it was because I figured if I got to go to college to play in the NFL, so I might have started doing this without anybody telling me, like this is what it takes. And by that time, you had to, I think you had to have 2 years of English, 2 years of math, 2 years of history, and 2 years of science. So I just figured, I said, well, I'm gonna double up. I'm gonna do 4 years. That way, just in case they ain't gonna kick me out, I'm gonna make it, right? But I was pretty much a C student all the way through high school, all the way through college. It wasn't until I decided to go, try to get into graduate school that I really found my academic kind of stride and my legs. And from there, I just did really well because I found the subject that I wanted to study. And and the rest is kind of history. I think my career
Uh-oh,
chose me instead of
did we
me
lose him?
choosing it.
Or did you lose
But I
me?
think she's there. There we go.
So
Can
we
you hear me?
lost you
Did you
for a
lose me?
minute. Yeah,
Oh, did
yeah,
you?
I lost you
Oh,
that
okay.
for graduate school. What happened?
Well, so when I actually chose, like, only reason I went to graduate school because that was at a point, and I said I wanted to learn. I really wanted to do. I had questions. I really wanted to learn. Kind of, I felt like I wanted to get smarter or something. So, a friend, I didn't know what I wanted to study, and a friend said, you're always talking about race, so you should study race in graduate school. And I said, you can do that. And she said, yeah, it's called sociology. And I'd never heard of sociology before in my life. And then within 6 months, I was in a PhD program for sociology. And then that turned me into doing medical sociology.
Wow, that's great. That's great. That's amazing. So I want to switch it up now. I want to talk about brain health and sports. So, Dr. Turner, why should we be concerned about brain health in sports? Why does that matter to us?
Well, that's a big question, and we could stay here for a long time. But for me, I would say it this way, and by no means is this a comprehensive answer. But when I was in graduate school, it happened to be at the time that Junior Seau committed, um, you know, um, suicide, and there were a number of other football players, big name football players. This right at the time CTE was coming out and all that other stuff, and so I started doing interviews for my book. And one of the football players out in California, as a matter of fact, really kind of was a seminal moment. The light bulb went on. He was telling me about all the trauma that he had gone through in his life, being an inner city kid. And I said to him at one point, we did a 7 hour interview, and I'd never done anything like that before. And he said to me, he said, man, I'd never told my story to anyone. He goes, God must have just put you on my heart. And we just poured everything out. And I said to him, I said, it sounds like you were depressed at this time in your life. And then he paused and he really got teary eyed. And he said, he said, I think that I was depressed my whole athletic career. He goes, but because I was doing so well, all everybody saw was this black kid, killing it on the field, but he was, hurting inside. And that sparked something inside of me. I said, man, I said, because I was a good athlete, but I wasn't good enough to be, have any kind of deficiency. I had to be on the top of everything, right? I couldn't have performed if I had, mental health issue or something like that. And so I really wanted to know, how does this happen? And then that just pushed me into more than just looking at mental health. I decided that I really wanted to start understanding about brain health, right? Because brain health can encompass injury, like, with questions around CTE. It can drug use, alcohol use, mental health. It can encompass all of those things. And when we think about black men, black boys, we know that we have deficiencies in everything with our health outcome, but we're always in our sports, we're overrepresented. And so I wanted to understand, what does that mean? Um, how does playing sports in particular impact our brain health and our whole transitions across the life course over time? And so that's how I got into starting thinking about it.
Wow, that's amazing. That's amazing. Thank you, Dr. Turner. So, Dr. Barkley, so hearing that and looking at CTE, I did put what it stands for in the chat, but for you, Dr. Barkley, what what should our coaches in middle school and even high school, what should they be doing to protect our scholar athletes?
Well, that's a loaded question too. There's a lot that we can do. I think a lot of it has to do with prevention. And I think, well, my big plug for middle and high school sports is that you need to have appropriate medical care. Most of our teams just don't, especially our Black schools, our inner city schools. They just don't have the funding. And then they don't really have medical professionals who are there to can really stop an athlete from playing, help determine if there's a medical issue, help them get appropriate treatment and come back when it's appropriate. Because I think that a lot of times, coaches can be great for youth. Sports is great for youth. There's so many positive benefits, but you can't expect that a coach is going to understand when somebody has a concussion and understand exactly what to do or understand how to treat that. So I think that's the first thing, is that every athlete deserves to have access to health care. And I think that's going to be one of the first things that parents and coaches and all can do, is to try to advocate for that for every athlete. I think the second thing you can do, especially in the youth sports, is proper equipment. That's the other thing that happens. The helmet doesn't fit, the pads don't fit, the field is broken down. All those things can really contribute to injuries and concussions. And trying to take a look at that, take a look at pre-season conditioning and in-season conditioning, so that you can kind of be at your best. I think just also paying attention to the overall athlete, like Dr. Turner was saying, like the athlete that was a good athlete, but had a lot of challenges that nobody was really paying any attention to. I think coaches and parents can take a look at their athletes, know them, understand when they start to act differently, do things differently, and pay attention to that and ask them, checking in, asking them what's going on, can make a big difference. Because I think a lot of people experience that nobody ever asks them how they are. Nobody ever really does check in. And many people have things that they would say if somebody would ask them. So I think that all those things can kind of work together to try to help our young athletes prevent concussions and stay well. I mean, millions of kids each year get concussions. It's a very common injury, and it's cumulative, the effect on the brain, as we've learned. So
let's go into that. Let's go into that, Dr. Barkley, because you just said something that pricked my ears. Tell our audience, what is a concussion? So if an athlete has been concussed, what is that?
A concussion in sports is a brain injury from impact, whether your head hits the ground or your head hits another part of someone's body on an opposing player. And there's kind of like that shaking that happens in your brain. And, your brain is a soft tissue within a hard skull. So when the brain shakes around as a result of the concussion, there's impacts that happen at the microscopic level, et cetera. Sports-related concussions are usually not associated with, like a bleed in the brain, or like, some actual tearing or that kind of damage, but there's a lot of microscopic damage that's hard for us to really quantify. When you sprain your ankle, you can see it getting swollen and bruised and everything. When your brain gets bruised, we can't really tell for sure that that's happened. So that's why it's important for everyone around, from the coaches to the other players to the athletes themselves, to be aware that these are happening and try to get help when it does. Sometimes the symptoms are unclear. You could be confused, or you can be just dizzy, or you can just have a headache, or sometimes you get nauseous, or sometimes you just act funny, act like yourself. So there's all kinds of symptoms that can happen from a concussion. And that's why the observation is important. Sometimes someone else will see it before the athlete may see it. And then, of course, athletes want to play. So sometimes they don't want to say that they have a problem.
Right.
Can I jump in? Can I jump
Yeah,
in a
jump
second?
in.
There's a whole lot again to unpack, and we could go, do this for a long time because I think it's really important. But just a minor kind of mention on that last thing is that just want to make sure that people recognize that you don't actually have to have a blow to the head to get a concussion. It can even be shearing, it can be shaking, it can be lots of different things. Um, you know, um, Generally in sports, it is some kind of contact, but sometimes it can be just a violent jolt that can actually do it. And the reason I want to mention that, not only that though, is, and people don't realize this a lot, but and we'll get into CTE at some point, but we have found, I'm working with the people up at Diagnose CTE at Boston University, and the second largest group of individuals who have been diagnosed with CTE, or the syndrome, because you can't diagnose it until postmortem, but it's victims of domestic violence, right? So we've actually found that to be the case. And we can go into that a lot later, but I do want to address a little bit about like, what can we do to protect our children that are playing sports? And I think that this is something that we really need to pay attention to, because as an example, one, I just think that when we have the sports industrial complex that we have in the United States, especially when it comes to youth sports and people thinking of kids as though they're playing professional sports, right? And parents going crazy in the and fighting, in the stands, or people threatening to kill referees and coaches. I think we need to reprioritize and recognize that we need to let the sports provide for kids what it actually does. It's great health and exercise. There's team building. It's learning how to overcome adversity. We shouldn't be thinking about little kids as being the next LeBron James. I mean, the next LeBron James, whoever that is going to arrive, right? No matter what we do, right? But the vast majority of young people, to play in the NFL, I think it's something like 2% out of all high school kids are going to, I mean, parents can do whatever they want and think whatever they want. Your kid is just not going to be there unless that kid is going to be there, right? We can help them be the best that they can be along the way. But I think many times we need the proper parental involvement, that's healthy, putting the kids first. And then I think the other thing is when you look at sports in Europe, believe it or not, in Germany, as a matter of fact, every coach, even volunteer coaches, have to be certified. They have to learn how to actually coach. Here in our country, all you have to do is volunteer. And that's a great thing, right? But some people, they're volunteering and they get caught up and they have their own, kind of wanting to win a championship for themselves instead of for the kids. I think, we have to always think about what's health mean for kids emotionally, physically, mentally. When we do all of those things and we have parents involved, then we're going to be much keener on being aware of all types of injuries that kids can be exposed to.
I love it. I love it. Wow. I mean, so many things where you have just my ears just being pricked. So I want to talk a little bit more though about concussions and tie it in to brain health, because Dr. Barkley, you said that when a person is concussed, same thing with you, Dr. Turner, it's just something where I liken it to an egg in a glass, and you keep shaking it, right? So there are those, even the cracks at the microscopic level. So if a person is constantly, continuously being concussed, Dr. Turner, I want to ask you, have you seen, just like with the brains of those who have CTE and those are of Alzheimer's, are their brains similar?
No, the pathology is different between the two. You can actually see when you look at those two different brains. And again, this is getting real deep, but there's a lot of different ways that there are different. Um, but recognizing that they, there is neurodegeneration that takes place in both instances, right? So again, how the pathologies, how they actually appear are quite different. But the thing that it is important, at least from the work that they're doing in Boston University, that they found when it comes to CTE, which is in a class, quite different from other forms of neurodegeneration. But CTE generally is not related. The consensus generally now is that CTE is not a result of concussions, but it's repetitive head impacts, particularly over an extended
Oh,
period of time, right?
wow. Okay.
And yeah, and then the other thing is when we think about concussions, right? The big issue with concussions is not allowing the brain to heal, right? And when someone is concussed and they're in that traumatic, acute phase, and then having a second or a third concussion on top of that, that's where you see a lot of great damage. But what we're learning is if again you allow a concussed sports concussion, and again, also there's levels, right? So we're talking about mild traumatic brain injury compared to severe traumatic brain injury. They're quite different. So and there's even debate on how you define or identify those. We just are learning a lot more about, and I'm sure that Dr. Barkley could attest to this. We know so much more now than we did 10 years ago, and we will learn so much more going forward, right? But the big issue when it comes to concussions in particular is healing from that acute phase, right? Making sure that we protect the brain long enough for it to, go back to baseline. And when we find that to be the case, people tend to do very well after that.
Okay. So then let me ask you this, Dr. Barkley. Just looking at technology and how, we've come, man, light years. Is there new technology that can help with diagnosis of injury? Have you seen that in your practice?
Well, yeah, I mean, we've tried to evolve our care of concussions throughout my career over 20 years. I've seen so many different ways we've tried to know more better. It's still clinically based diagnosis. There isn't like a test you can do and say someone has a concussion. But I know one of the things that has been happening and that does help is doing like a baseline of some neuropsychological tests on athletes to figure out what they were like before the season started, and then try to do the same thing after the concussion and try to make sure they get back to where they were pre-concussion. I mean, it's kind of crude, it's not perfect at all, but it does give you some idea about the difference before and after and how to get someone back to where they were. The challenges that I have with young athletes is that the brain's growing still at 15 or 16. So getting back to baseline is not, what's that? You really like you change because now you're older and things are evolving. So some of that is still a little crude. And there are things that clinical tests that we do to try to help determine differences. There's been a lot of study about eye movements, and eye movements giving us a lot of information about what's happening with the brain and the recovery period as well. There's still a lot of testing being done about biomarkers. So maybe there could be at some point a test you could do, or genetic markers that could tell us who's at risk and how people can recover. There's a lot of study looking at helmets and putting sensors on helmets and trying to see about impacts over time, and seeing how that could help. Right now, there isn't a helmet that helps prevent concussions, but that's something that's always being looked at, and hopefully over time, we'll get more of these objective kind of tests that can help us with the clinical diagnosis and treatment.
Helmets with the sensors. That sounds so promising. So we need some of you engineering students to link up with some of our physicians and medical students to see how we can bring these two beautiful fields together. So thank you for that, Dr. Barkley. So
Can I add something into
yeah,
that? Can
oh
I add just
yeah, yeah,
real
go
quickly?
ahead, jump in.
I really love what Dr. Barkley was saying. I was just at the American Neurological Association. We had a meeting on issues around disparities, right, and equity, health equity. And one of the areas that people are trying to push forward, because you remember, we only just broke the code on, the gene code, mapping out the genes, and now we're looking at gene environment interactions, and we're really trying to uncover, kind of like we say, every brain is like a snowflake. But one of the things that people are starting to, and I'm glad you had mentioned these engineering, biomedical engineering, but people, what they're asking, how can AI help when it comes to brain injury, brain aging, brain recovery, those kinds of things. And what I would say this, and this is really kind of maybe on the other end of the spectrum of the work that I'm doing, but it's essential to everything, is with so much personalized medicine going and so much advancement taking place, we have so few Black folks that are participating in research, right? And it's really vital for us because, who knows, again, how our particular risk and protective factors will interact with some of this technology and those other things. So we need more folks on the end of involvement of developing. We need more folks that are involved with being able to do the science. We need more folks that are participating as participants in the research. If we want our voices to be heard, and we need, particularly the kind of care that is maybe culturally sensitive and aware, we're going to have to be very active and proactive, and we need to make sure that we can empower everyone. And I'm not going to say that that's easy, but it is something that I think is really important for us as a people to recognize that that gap is going to get much farther if we don't figure out how to actively have our voices to be heard.
Yeah.
Absolutely. Oh, I'm sorry, Dr. Barkley. Go
No,
ahead.
I
Go
was going to say amen as well. And I think that it's really important when it comes to concussion, when we're talking about baselines and what is a normal functioning brain. Well, there's disparities in how we do the tests. Like if there's not enough people of color in those measurements about what's a baseline or what's a normal, what's a norm for somebody, a 15-year-old, and there's hardly any kids of color in that pool, like it makes it really hard. It makes us such that a lot of times our tests are biased. And so then you're starting off with instruments that aren't really accurate as they need to be.
Yeah, and both of you hit on something that was key when you talked about diversifying the field, having the people to not only participate in the clinical trials, but also with the research and so forth. Dr. Barkley, can you talk to us about the work that you've done at Charles Drew with the rotation with our medical students in the NFL?
Yes. So I think my whole career I've been involved in trying to diversify sports medicine. As we said, there's so many higher proportion of Black athletes with such a lower proportion of actual Black physicians, primary care physicians in particular, who take care of sport athletes. So I think from multiple people's advocacy and multiple people within the NFL, they and NFL players through the NFL Players Association. The NFL started a couple years ago a elective or a program for medical students to actually train with sports medicine providers who take care of NFL teams. And so they started out with HBCUs, and I represent Drew on that panel. And I think I'm one of the few, though, who is a sports medicine physician at the schools that's been a part of that. So we've been lucky enough to have some of our students rotate with the Rams, and I think we had someone with the Chargers this year as well. And so this program has been expanding across the country. This year is being opened up to beyond HBCUs, and I know they want to continue to move that forward. But it's been, life-changing for our students who've been able to participate and really get to see behind the scenes to see what primary care sports doctors do, what the orthopedic surgeons do, what the athletic trainers do, this everybody on that sports medicine team, and learn in that way. I know that the students who have done it, it's really piqued their interest in going into sports medicine. And so it's hopeful to see that there'll be, more people following in our footsteps, because when you talk about that relationship with athletes, it does make a difference that you understand something about them culturally and socially, so that you can make those relationships, so that you can say, hey guys, what's going on with you? You're not acting like you usually do, and just ask that question. And I think that does go a long way for people to feel comfortable, for the athletes to feel comfortable seeing somebody who looks like them being in charge of their medical care.
Dr. Barnes, can
Yes.
I ask you a question? Because this is awesome. I'm like crazy loving hearing what I'm hearing. But so people who are doing the sports medicine rotations, are most of them in orthopedics or something like that? Or are there many psychiatrists that are part of this sports medicine? And here's the reason that I ask this question is because I'm around former professional football players and existing players all the time. And one guy told me very starkly, it was an aha moment. He and his wife were going to counseling together, and the counselor, who happened to be a woman, and it was not a woman of color, but it was obvious to my buddy that she did not understand the world of athletes altogether. And she said to him, "You seem like you're very aggressive and you're angry." And he said, clearly this has nothing to do with anger, anything like that, but it goes back to what you were just saying before, recognizing someone's demeanor, those kinds of things. He, playing the sport that he did, he's an alpha male, so to speak. And I was just wondering, do psychiatrists get exposure in this kind of sports medicine as well? Because I think when we talked about mental health, these are the people who might be in the best position to help some of these athletes if they had the exposure and training to them as well.
That's a great question. So this rotation is with medical students before they've differentiated themselves as specialists. We want those medical students who want to go into sports medicine and currently fellowship training. So you have to do your primary specialty first, and then a fellowship is the specialized training you get in sports after the residency training. So we've targeted people who want to go into primary care sports and orthopedic sports medicine for this rotation. But they're interested in expanding and trying to get other aspects of it, of the sports medicine team, because it's a team. Like, no one provider can really provide all the care that's needed. There is sports psychology has been a field for decades, where and most teams have that. But sports psychiatry, which is the physician mental health provider, is a new field. And I have heard of people who have been interested in that and doing some training. I'm not aware that there are any fellowship programs. Maybe there are, and I don't know. But it is an emerging discipline. And
Okay.
I think that's really, that whole relationship and understanding when there are issues is something that the primary care sports medicine person, I think, is the person on the team who provides a lot of that care, and then being able to refer to a psychiatrist when needed. And of course, the psychologist on the sports medicine
Right.
team.
And all of that is about it's about relationships. It's about because especially with men, you go and start to ask them about these issues. They don't know you. It's going to take a long time for them to open up. And I was just thinking about what we were talking about before. People who have been kind of in those rooms, as well as people who look like them and come from the backgrounds they come from. Those might be really, the mechanisms that are necessary to get people to open up.
Yeah. And one of the plugs that I always put in there is that most of them are adolescents and young adults, and their healthcare is different. You need to talk to them differently if you're going to get any information out of them, and you're going to build relationships. So that's why it's so fascinating and fun for me, is training both sports medicine and adolescent medicine, is to really try to understand that developmental process you can't understand certain things when you're 13 that you can understand when you're 18. You have to talk to them different manners. I think all that makes a big difference when you're trying to build that relationship over time and try to help ameliorate some of the problems. Every time I see a pro athlete who's really struggling, acting out behavior problems, it makes me so frustrated because I'm like, that guy has been around medical professionals since he was a teenager, more so than any other person, but nobody saw that there was trouble. Nobody was asking them about this, because a lot of times we just get into the thing in sports of, I care about your ankle sprain, I care about your knee injury, and nobody cares about the whole person. So that was one of the articles I did a few years ago. Some colleagues, is like the holistic athletic healthcare model, where you care about the whole part of the athlete. You look at them within the ecologies of their interpersonal, their family, their community, their school, because all that's necessary if you're really going to provide good care for an athlete.
And this
That's
goes back to
wonderful.
what you were talking about before. I'm sorry, I didn't mean to cut you off, but it really goes back to what you were talking about before. And this is why so many guys, when you talk about sports psychology, they're like, wait a minute, I know all that is about the team only wants me to make sure that I'm performing at my actual, highest level. None of that suggests to the athlete that you care about me. You care about my performance, but you don't care about what happens to me when I walk off that field. Right. And then I think what you're talking about is that holistic from a young age, teaching me how to open up to a professional. So that way, when I get older, it's commonplace. When I'm starting to feel this way, I know how to go seek out help. And I know what it means to actually talk to someone about my feelings. Right. Where I've been learning all this other time that my feelings, if I keep them suppressed, that's what makes me great on the field.
Right. And you don't want to say things that it affects. If you tell the coach certain things, they're not going to play you. If you tell, what I mean, there's so many other political factors, social factors that happen in that sports environment that, it's important that, they can have somebody on the team who does care about them and can think broader than just tomorrow or next season. And then, because I think what we're finding from the studies that have been happening on NFL players, that there are a lot of health issues that follow players after they are finished playing, and a lot of disparities that even though they have access to care, the care may not be appropriate care because there's still a lot of health disparities in professional athletes that you would think they wouldn't have because of their access.
Well, that's what
Right.
makes in some of the respects, that's what makes them, because again, we know about social determinants, and right. So some people come from these environments, and then what happens is you essentially put them in an environment and an institutional setting where you care for everything for them. But you may not have ever addressed some of those other underlying things. You just made sure that they can maximize their performance. And then
Right.
once they're done, right, it's some of those other things may wind up rearing their head in all these other different ways. But it goes back to what you're saying before, and that is sports, especially at the highest levels, they prove to you they care about you as an athlete. They don't care about you as a person, right? And then us professionals are trying to go back at that point and build relationships and say, okay, let's figure out what is going on here. How can we help you in these other ways?
Right. And it's all about us, just like what Dr. Barkley stated with the training. And so I'm so happy that Charles R. Drew University of Medicine and Science, we have this rotation where our mission is, living in a world without health disparities. So just taking that mission and, leading and going to the NFL and making sure that the mission, it's within us and we can, just share that with the patient. So that's what it's about too. So, okay, you guys, we have like a few minutes left. This is good. This has been like a great conversation. But Dr. Turner, so we heard about Dr. Barkley and this fantastic rotation. Can you tell us, Dr. Turner, about the Black Men's Brain Health Conference?
I can and I want to, but I got to preface this by saying so much of what we've just said so far, we focused on sports, and it kind of, we intimated that it's like football and that. all of this applies to women too. Or other It's just important, right? And people transgender. Nobody. I don't want to leave people with the opinion or the thought that maybe all we're talking about is how this affects boys in sports, because
No,
there are other
of course
issues,
not.
and I want other people to know that we need them involved with sports from their unique perspectives and their cultural understanding as well. So I just wanted to say that real quick.
Of
Okay.
course, of course. We're all about that at Charles R. Drew University of Medicine and Science. I believe we're the second most diverse school in the nation. So yeah, we're all about that. We got you.
Good, good, good. Because I happen to, I'm one of those guys that I kind of grow where I'm planted. I'm a Black male, so Black men's brain health is really important to me. But one of the other things that drove me here is the overrepresentation of Black men in college and NFL, right? So NFL is something like 70% Black men, and then when you look at college football in the Division I level, it's 60%. But then if you look at the men in college who actually are playing and the ones who are generating all the revenue, it becomes like 90%, right? So we just talked about all of these health factors and risk factors and inequality and everything else. And we talk about how underrepresented we are in science, right, on all different levels, and we're overrepresented in the sports, and that's a much larger risk factors for some of these injuries that we're talking about. So essentially, that's why we started the Black Men's Brain Health Initiative, is because we understood and have heard so many different times, and everybody hears this all the time, that when it comes to the overall health profile, Black men have, some of the worst, if not the absolute worst, health profile of everyone, right? And so what we know is some of the things that we've talked about before. What's really important, we say, what's good for the heart is good for the head, right? So we care about the whole mental health and the physical and all of that other stuff holistically, as Dr. Barkley was talking about. And so we're trying to, with our Black Men's Brain Health Conference, we're trying to disseminate information, but we're really also trying to get members of the community together, the researchers together, the clinicians together, community-based organizations, all to help us on a very local, regional way understand what are the issues that Black men are dealing with in your community. And if we can bring the clinicians, the researchers, or all of them together, we can have the dialogue and start figuring out, not in the ivory tower, but right there where people live, how do we understand these risk factors? How do we start hearing, taking a very culturally aware perspective to come up with solutions, as well as interventions and advocacy? So that's essentially what we do.
And when is the conference, Dr. Turner?
Sure. So all of y'all who are out on the West Coast or anywhere, but our conference is always the Super Bowl week. We partner with a local, university, local institution. So this year we'll be at UNLV, and the Super Bowl, I think, is February 11th. We're going to be there from February 5th to February 8th. We'll be on campus there. Really proud of the fact that one of my mentors, Dr. Keith Whitfield, who is the president of UNLV, is a Black man, and he's on our advisory board. They're hosting us. And one of the things that most people don't know, but they proudly say at UNLV that they are considered to be the most ethnically and racially diverse university in the country. Right. So I was really surprised at that, undergraduate level, at least. But yeah, so we're going to be there. The conference is we have a pre-conference on the 5th, and then the regular conference is the 6th and 7th. People can go online to our mensbrainhealth.org website. It's free to register. We've been very fortunate to get funding from the National Institute of Aging, the Alzheimer's Association. We have a partnership with the NFL Alumni Association, and you can participate in person, and it's free, or you can register online and participate virtually. This will be our 3rd year. We usually have about 250 people in person, and last year we had over 1,500 people register and participate online, and people from 10 different nations were represented at the conference.
That's great. That's great. Wow, that is amazing. So we do have a question in from one of our attendees, and he writes, can brain damage be detected from a DNA test? I think we answered that, but you want to give that answer, Dr. Barkley?
No, I'm not aware of any test that will help me diagnose it. Not at this point.
Yeah, no, not that I know of either. But I will say this: we are making real big strides with having blood-based biomarkers for Alzheimer's detection, which some people may have seen this in the news recently. There was a famous actor who had the test done and found out that he had the gene, which made him more likely. Did not mean that it was not like Huntington's disease, where if you have the gene biomarker that you will definitely have it. It just makes it, you're at, I think, at a 20% greater risk. But what we tell people all the time is really, really important. And this goes back to kind of treating someone holistically, like Dr. Barkley was talking about, is when you see signs or you even think that there may be signs, go get tested, go to speak to professionals about any kind of memory issues that you might have, because early detection means that we can have some early interventions, and so many different things are being we're every day, so many different breakthroughs are going through. And one of the things that winds up happening with us particularly, I just want to say this to people in the audience: Black Americans are almost twice as likely to be diagnosed with Alzheimer's disease, right? But we are diagnosed later, right, in the progression stage, right? And we are misdiagnosed more often. So all of those things are really important to, like Dr. Barkley say, having strong relationships with your primary care physician, advocating for your family members, your loved ones, and understanding your risk profiles and really understanding where you are is going to help, you know, with working with the healthcare professionals to come up with solutions that are best for you. So it's really important in that respect.
Wow, thank you for that. So in the couple
And
of minutes,
hopefully one of you guys can figure out if there's brain markers in your careers. There's
absolutely.
We're
genetic
trying.
markers. I mean, there's so many things, scientific advances happen because people have out of the box thoughts, so I think the more you dream about these things and work hard to have the knowledge to do it, we'll continue to make discoveries.
And to that point, I would almost guarantee, although I'm not a betting person, the biomarkers or the way they may function and white folks is going to be different than it is in Black folks. And so therefore, we got to
Wow.
learn what's going on with Black people.
That's true.
Wow. Wow. So in the minute that we have left, so Dr. Barkley, just any last words, something that we just should know. Last words.
Uh, you can do whatever it is you're thinking about doing in your career. Just go ahead and do it and let everybody catch up to you.
I love it. Dr. Turner, last words, something that we should know.
Well, first of all, know that there is such thing as Jersey Strong. Dr. Barkley shows, Dr. Turner shows, we got it going on in New Jersey.
That's right.
There you go. But no, I just want to echo what she just said. I think two things. One, we have to empower young people, right? Because it is one thing to have them dream, but I've learned all along the way, people have to help facilitate them be able to live their dreams, right? And I think that these kinds of conversations we're having are so important, right? Because if we stand one by one, we're not strong, but if we stand together and we help people live their dreams, and we're gonna be better for it. And so I just greatly appreciate being on a conversation like this, because it really is about us helping one another get to where we need to get to.
Thank you.
Amen.
Thank you so much. Yes, wonderful. So it's about that time. Thank you so much for joining us in the Lion's Den. Panelists, please stay on. But for everybody else, thank you for joining us, and stay tuned for the next installation of the Lion's Den. If you are interested in applying to Charles R. Drew University of Medicine and Science, you can visit us at www.cdrewu.edu. Once again, that's www.cdrewu.edu. Check out our undergraduate programs as well as our graduate programs. We do have a program for you if you are interested in a career in healthcare. So thank you so much and have a powerful one, you guys. Thank you.